Hello, guys. This is Tori from the Fruitful Fertility Podcast, and I am here with Dr. Laura from the Well Adjusted Mama Podcast. And today you are in for a treat because we have both of us here talking about how functional medicine improves fertility outcomes and is a great way to prepare for pregnancy and improve fertility. And so we've got Dr. Laura has over 23 years of experience. I'm running on probably 10, 11 years of experience now that it's 2026. So you have years and years of combined passion and experience in this one episode. So we are both very passionate about functional medicine, and so we're going to talk about that and why this is the model we use in our practices. So let's jump right in. Dr. Laura, tell us a little bit about when women hear the word functional medicine for fertility, what do you think they assume that means, and what do you wish they knew instead?
Well, that's an interesting question. I think functional medicine is becoming so much more popular. I've been using functional medicine in my practice for 23 years, like you mentioned. And I feel like 23 years ago, there was a lot less mainstream knowledge or interest in functional medicine. It was kind of considered an outlier. And I would say now, like, it is definitely something that women and men are searching for because they're really feeling that they're not getting the care that they deserve from allopathic medicine. The allopathic medicine model in general is broken when it comes to primary care type treatments and certainly prevention and wellness care. So if somebody is looking to stay healthy, they're probably not getting a lot of support when it comes to that type of model. And certainly if they have a chronic illness, the same thing. So I find that it really thrives for like emergency medicine, right? But other than that, when people are really feeling like they're just kind of dragging through life and they're really not sure
Hmm.
what's going on, and maybe medications have been added on one after another, and then more medications to treat side effects of the medications they're on, they're feeling frustrated and they're like, this is not quality of life and this is not how I want to live. And we're also seeing a shorter lifespan with the next generation, which is concerning. So there's an awareness that our lifestyles we're getting sicker and sicker, and traditional allopathic medicine is not supporting and getting us out of that sickness stage. So that's where functional medicine really shines, because functional medicine is really about supporting root cause resolution. And usually it is causes. So once we identify what's creating this, then we can heal, and then chronic illness is resolved. And certainly, then from a prevention perspective, you can have no symptoms and still technically have illness in your body that you're not aware of yet. And what I like about functional medicine is we can dig deeper with specialized type of testing to discover this and treat it before it becomes even symptomatic.
Yeah, absolutely. I feel like just that phrase, dig deeper. I feel like the difference in the allopathic medicine model and the functional medicine model is, but we can talk about root cause and certainly that's it, but it's like we're digging deeper. Like we're not just settling for like, oh, I don't feel good, or oh, that hurts, or oh, I can't get pregnant. It's like we are looking for answers of why this is happening. And I talk a lot too about when you go the functional medicine route, that you don't have to keep coming back. A lot of times with, modern medicine, it's like you get a medication, but it doesn't really solve the problem. And just like you said, then we have to take another medication to, interact the medication we took that's causing these symptoms. So you have to keep going back and you have to keep piling on. But when we get to the root cause and we root it out and fix it essentially, then we don't have to keep going back and we have more of that like autonomy of taking care of ourselves. So I think it's not only answers and clarity from a root cause perspective, but it also provides like empowerment of like, oh, like I can be in control of how to help my body as opposed to having to always go and get a band-aid essentially.
Yes, the empowerment piece is huge, because what we see, if we look back within the past 100 years or so in allopathic medicine, there was very much this shift where even the American Medical Association was wanting to take power away from natural types of healing. Chiropractic, homeopathy, midwifery were really being suppressed because it was considered a threat to the medical doctors. And so the association was wanting to contain and eliminate these professions. And they did that through like, these are quacks. This is what they taught medical students. So when the medical student became a doctor, the doctor's telling their patient, don't go to a midwife, don't go to a chiropractor, don't go to a homeopath. These are dangerous. They're going to hurt you, or they don't work. It's, snake oil.
Hmm.
And they were creating a fear mongering response. And especially back in these decades, people really honored and looked up to their medical doctor as God. It's like whatever they said was done. There was no internet, there was no social
Hmm.
media. They didn't have resources to get the research on their own, and they did not go to medical school, right? So they did not know. They just trusted. There was a lot of trust that was put in this. So whatever your doctor said, that's what you did. And now we see there's a huge shift from that because there's an awareness that we can go to Dr. Google. We may not always get the best information, but there is so much information
Hmm.
out there, and we can research and we can ask around on forums and talk to other patients that live all over the world. And we can get connected with other referrals to types of practitioners. That was really hard to do before the internet,
Hmm.
right? It was like you really were kind of just stuck to whoever was in your community, and maybe they knew somebody who knew somebody, but it was really not as accessible. Now we have virtual consultations, and you can work with a practitioner who really resonates with you, really respects you, really is there, and is really skilled at helping you heal yourself. Because that's the bottom line here, is healing always happens from the inside out,
Hmm.
never from the outside in. And so you have to have the mindset that you are healing your body and you're not giving over your power to someone else or to something else like a medication, because that is never going to be the solution. So that is important. And I also think that if you are told that you have an illness or a diagnosis that you will have for the rest of your life, and therefore be medication dependent, let's say it's type 2 diabetes, for the rest of your life, and you believe that, then that is what will be created. That is what will happen. You will be on that medication for the rest of your life to treat your type 2 diabetes. However, if you have an awareness that you can choose something different for your body and your health because it is your body, then you can heal yourself from type 2 diabetes.
Hmm.
You can heal yourself from cancer, and you can heal yourself from honestly anything that is going on within your body with the power of the mind. So that is so important for everyone to remember. And I always say this, especially to my new parents coming to my practice. They're bringing in their babies, and they're feeling like they're getting a lot of information that's potentially conflicting, and it's overwhelming, especially for a first-time parent. And I'm just like, you have to listen to your intuition,
Hmm.
especially as the mother, your maternal intuition, what seems and feels right for what healthcare decisions you need to make for your baby or for yourself. And if you're not getting that information from the practitioner who's right in front of you, then you can find somebody else. That is what we have accessible today. And I think that we really need to embrace that. And I think a lot of people are like, you know what? I'm going to fire you. You're not doing your
Hmm.
job, doctor. I'm going to find somebody else who is. And it might be a different type of practitioner. And a lot of times there's a team, depending on what's going on, you need a team approach. So a bunch of practitioners working together to all help you get the outcome that you're looking for. But being clear on what you want for your health, and then creating a team around that, is really how we get the best results.
Yeah, amen. I completely agree. And I even tell my clients when I'm working with them sometimes, like, you are the captain of your ship. So I'm going to make some suggestions of how I think we can move forward. And I want you to tell me which one feels the best to you. Like, I don't want the exact same thing that was happening at the doctor's office to be happening between us, where I'm
Right.
telling you what to do and you're listening to me and you think that, I'm the end all be all. I'm here to help you and guide you. But just like you were saying, you have to listen to your intuition, because exactly like you said before, too, like, what you think is what's going to happen. And I find, especially with my fertility clients, one thing that it just makes me so sad and breaks my heart is they go to these fertility clinics and the doctor will say, you only have a 4% chance of getting pregnant naturally. And they wear that, and that thought seeps down into their thoughts and their body and the way they show up to life. And now they have decided they only have a 4% shot at getting pregnant naturally. And I'm like, where did they get that number? Did you ask
Yeah.
them to, like, show you the math and how they got that number? Because from what you shared with me, I don't see that. And so it kind of drives me
Yeah.
crazy.
And guess what? Let's say that 4% number is even true, then you have to focus on the hope of that 4%. 4% is larger than 0%, right? So, and actually, nobody can even say you have 0%. Like that would just be because miracles happen on a regular basis. So,
Amen.
I really don't like it when people put limits on other people's healing. And I
Hmm.
think that if you are receiving those types of messages, you need to really create boundaries and protect yourself, because that does not have to be your story. That does not have to be your experience. There could be issues that are currently happening within your body that might interfere with fertility, and you have the ability to heal and respond beautifully to creating health essentially. If there is a low ovarian reserve, or if there is PCOS or these other types of issues going on, you can still heal. You can always have that ability, but you have to really truly believe it in your heart and soul. And you know I think it's good to be very positive. Positivity is how we create health, and having, some sort of message that you're telling yourself on a regular basis that is very positive, personal, and present tense. I am conceiving a healthy baby. Like, what do you want to create? Don't focus on what you don't want. You have to focus on what you do want. And if you want to get pregnant, with a healthy baby. We always want to say that full term healthy baby. I always like to throw in there in the empowered birth because why not? Let's
Hmm.
have it all, right?
Hmm.
Let's not just get pregnant. Getting pregnant is just the little first tip of the iceberg,
Hmm.
right? If you talk to any woman who's gotten multiple miscarriages, getting pregnant is overrated, right? So it's really about getting pregnant, having a healthy pregnancy, a healthy baby, and an empowered birth at the end of that. And then you're really creating that beautiful, empowered motherhood that is going to have this beautiful child at the end of it.
Yes, I love saying too that when you focus on the functional medicine aspect to improve your fertility, get pregnant, have a healthy pregnancy, have a great birth, you're also setting yourself up for a healthy motherhood because
Yes.
that newborn season and toddlers, I mean all of it. Like I have a 9 and 7 year old right now, and there's ways I have to take care of myself that are different from when they were tiny, but still it remains the same that I have to take care of myself from the inside out, like you were saying, because the way I show up in motherhood depends on that. So,
Yes.
like you said, it's just the tip of getting pregnant is just the tip of the iceberg. So when you come at it from a functional medicine perspective, get to the root cause, realize that you are the captain of your ship, you got to heal from the inside out. It's a domino effect of how it influences your life. It's not just this short term, let me get pregnant. It's like now my health through my entire life and motherhood journey is going to be different, which I think is just, like you can't beat that. You can't get that anywhere else.
Yeah, it really is important. And that goes back to once again listening to your intuition that's really guiding every decision you make throughout the pregnancy, throughout the birth, and then throughout the rest of your life as a mother. And that making decisions from that empowered place of your intuition, where you really trust and honor that you know what's best for yourself and your child, you will definitely raise your child differently than someone who is feeling fear
Mhm.
and scarcity and manipulation from outside sources on what types of decisions they're making regarding the health care of their family, right? So it's really about how are we making decisions for our health, for ourselves and our family. And if you feel like it's like, oh, I'm choosing to do this because I'm afraid,
Mhm.
then you really want to question that and say, well, why am I afraid of this? Like fear is real and we don't want to suppress that either. But then we also want to say, well, can I make a decision that feels empowering versus like I'm doing it so I'm not afraid, right?
Yes.
It really comes from a different type of energy. And when we're really in tune with that, which I do find like a meditation type practice or a mindfulness practice allows us to tap into our intuition at a deeper level. and that feels like much more clarity, that we can really be like, oh, it's so obvious. This is what
Yes.
I need to do right now for myself or for my child, right? And we're not questioning it. We're not like, it's like, oh, well, I know that person down the road is doing something different and that's their choice, but we can make a different choice. And I think as humans, we're such, there's that animalistic, like, we want to do what everyone else is doing, right? We want to kind of be the sheep following the herd, so to speak,
Hmm.
because that feels safe, right? Like back in the day, like we had to do that to survive. And so it is harder if you see on social media, everyone's doing this, or in your community, everyone's doing this. It can be harder to choose something differently. But if that's what resonates for you and your family, then that's what you do.
Yes.
And it's okay to make those different choices. But I see that when it comes to holistic lifestyle, that can be challenging for people, right? Because it isn't mainstream. That's what we're talking about here is the bottom line. What we're speaking to is not mainstream yet. And so whenever we do something that is we're in the minority, it can feel a little bit more uncomfortable.
Yes, absolutely. My programs are Christian based, which is, not fitting for everybody, but we in my program we talk a lot about like are you making decisions based on faith or fear? Like every time you make a decision, I want you to stop and say to yourself, am I making this based off of faith that I have that Christ will take care of me and is leading me accordingly, or am I making it out of fear because the doctor spoke some horrible statistic over me or told me what my body was capable of. And just kind of like you were saying, it's easier to go with the herd mentality and what everyone else is doing, but you have to think, okay, I've been given this child, I've been given this body specifically, and how I have to lead it in a way that feels right to me. Because even as a mom, like I have done that before where I'm like, well, I'll just do this because this is what the majority of people are doing. And how that voice in the back of my head was like, I don't know. And then when you make that decision, it doesn't feel right. Like you're not going to feel good stepping into decisions that are based off of fear. It's not going to feel right. So even just like you were talking about before of making decisions from a really empowered and positive place, it
Yeah.
drives everything, like the way you look at it, the way you show up. Because if you make a decision based in fear, then every step you take in that process is fear based. I don't know if this is right.
Yes.
This doesn't feel good. Yeah, I don't
Yes.
know, all that. So then when you make it from the other one, more empowered, trusting your tuition, is this faith based, whatever fits your, spirituality, then everything feels good and it feels more aligned. And so you show up differently and it feels differently. And that in itself has physical effects.
Yes, exactly. There's a flow and an ease to it. The practitioner that you've been searching for shows up, when you need them the
Mhm.
most, right? Everything that you need will be provided to you. And it's not hard work. It's like it's just this effortless ease and grace when we're in that type of flow of trust. And once again, when we're really stuck in that fear and scarcity mindset, then things will feel hard, they'll feel scary, and we will not be able to trust our intuition. We will have an actual distrust on really what knows best, what the best answers are. So it's really important to be mindful of that. And I think also back to that positivity or optimism when we are around a lot of pessimistic people, or if we find ourselves being pessimistic or negative, then it's going to move us towards that fear, right? We're going to move away from the faith. We're going to move away from that trust. We're going to move away from our connection to source. So, um, if you find yourself in that negative self-talk, or if you're surrounded by people, it could be your doctor at the fertility clinic who has that negative self-talk, or the nurse, or your mother-in-law, whoever these people are. That is so important to protect yourself. I especially say that during the perinatal phase of a woman's life. When you're actively looking to get pregnant, you are pregnant, or you've recently given birth, that really sacred container. We are so open as women, more so than ever in our lives. And we have to put up boundaries and protect ourselves from that negativity. It could be the news. I don't recommend watching the news. I really recommend limiting exposure to even a lot of social media and certainly negative people in your life. You need to put a little boundary around. If they start talking their talk, it's important to just politely, you know, um, change the subject or
Mhm.
walk away. Do what, and it's not rude. It's not rude. You are protecting yourself when somebody is just ranting and raving, and my southern accent's coming out. They're just going on and on about how horrible the world is, or blah, blah,
Yes.
blah, or oh my God, you're 40 years old, you'll never have a baby, or whatever their story is. You don't have to absorb that. You do not have to make it your story. And I think that is so important, but it's really hard. So it's just the first step is to always be aware. Once we're aware, then we can make different decisions. If we're not conscious of our negative self-talk or the negativity around us, then it just becomes our normal. Like everything is, going to hell type of thing, right?
Yes.
And then it's like, well, but that's not true, actually.
Hmm.
So I'm going to create a different story, and you can start doing that immediately with
Yes.
with the self-talk in your mind.
Yes, I love that. Like not taking everybody's opinion because as I know you know that when the minute that you become pregnant, everybody wants to tell you their horrible birth story. You know,
You
everybody's
definitely do not need to hear any of that. You want
yes.
to hear the positive birth
Hmm.
stories. And by the way, they do exist.
Oh, absolutely.
There's a lot out there. I tell people read Ina May Gaskin's
Yes.
book. She has
Yes.
beautiful birth stories. I'm writing a book. My beautiful birth story is going to be in
Yeah.
there. And I tell people in my office, I tell them my beautiful birth story. And when they start talking about their sister and their friend who
Mm-hmm.
starts birth is so horrible and this is what happened to me. No, ma'am, you don't
Hmm.
want to hear that story. They can tell it to their therapist,
Yes.
right? They obviously are feeling the trauma, they have PTSD and they need to release it, but
Hmm.
it's not your job as a pregnant mom to take that on, and it is not helpful for your pregnancy or birth.
Yes, absolutely. I think kind of this is the way I think about it, letting people speak into your life. So you talked at the beginning about like building a team that feels really good, like not just one person, but a team of providers.
Yes.
So when
Yes.
you have providers that are aligned and positive and not,
Yes.
sterile and clinical the entire time, like obviously you want them to be educated and clinical, but that can also pull you out of your emotional roller coaster. And then I like to say, like, have three people in your life that you trust. So, obviously, your partner, the person that you're trying to make this baby with, a provider, maybe two providers, or maybe there's somebody else in your life. Maybe it's your mother or a mentor, but being really strategic about who you let be your wise counsel. Because, like, you were
Mm-hmm.
exactly like you're saying, you don't want to let
Hmm.
everybody speak into it because everybody's got their
No.
opinions and and people have negative opinions. So we want to feed our mind and our soul positive stories, just like you're saying. So
Yes.
be very strategic about the three people, and obviously that's not a set number. You can do more or less, but like
Yes.
just a good general rule of three people that you allow to step in and speak truth over you when you need it. And
Yes.
I think that's so
Yes, it's
important.
your counsel. You get to choose who gets to come in, and you get to be very strategic and deliberate about who you allow in. 100%. And I think that's also empowering when you know you get to make that choice. And if that person it doesn't make the cut, then that's
Hmm.
okay.
Hmm.
It doesn't mean that you don't speak to that person, but they just
Yeah.
have to be kind of pushed into that back burner. And anytime if they want to talk about how hard it was for them to get pregnant or how many miscarriages they had
Yes.
or what a miserable pregnancy they had, then like once again you have to just change that subject and
Hmm.
recognize like that's not I'm not, we you might even say like I really rather not talk about that. I'm sorry that you had that experience, and I'm looking to have a very different experience. I
Hmm.
think that's also important for as women that we speak up when we have positive experiences, because I think sometimes we feel a guilt or shame when our girlfriend or sister had the opposite. Oh, they don't want to hear about this. But like it's good to share these messages, and the
Hmm.
younger women coming up as well need to hear these positive messages. They need to know what is possible for themselves. And if all they hear is negativity, then they're not going to know the possibilities that are out there. So it's okay to talk about your positive birth story as well, right? And
Mm-hmm.
share that. Just like we would say, like, oh, I got this really amazing gift for my birthday, right? Like we can talk
Yes.
about nice things that we've received. Why not talk about the amazing, like how we felt so great during our pregnancy and we had this beautiful birth at home and, all the things that are possible for us as
Mm-hmm.
women. How we literally elevated our consciousness because we had an unmedicated vaginal delivery in the water. Like that is what's
Mm-hmm.
possible for every woman that's interested in having that for herself, right? It's a choice.
Yes, and that's why Craig Rochelle, he says he's a preacher and he says what you feed grows and what you starve dies. And so it's like you
Yes.
feed yourself just like that Ina May book. I have my clients who are not even pregnant yet read Ina May's book. I'm like, you don't have to go natural if that's not what you're looking for, but I want you to read this book because I want you to feed your mind and feed your soul all these positive stories of women that were just like you who gave birth in this beautiful natural way, and this is exactly what can happen for your body too. And do
Yes.
you remember, I guess this was like in the 90s probably. Do you remember Chicken Soup for the Soul, those
Yes.
books? I was like, we need to bring back Chicken Soup for the Soul for women that are just like women's stories so that when you need to turn off the news, you need to get off social media, and you need to read Chicken Soup for the Soul to feed yourself empowering stories of
Empowering
women. Because
miracles.
yes, because it happens all the time. And I even had a client recently, she became pregnant. She had a previous miscarriage, so she's really dealing with the emotions of having another miscarriage and fighting that fear. And this is the exact conversation I had with her. She said, that her friend had a miscarriage and had reached out to her about it, and something else had happened. And I said, I said, not that you can't be there for your friend. I absolutely want you to, like, share your testimony, share how you got through it, help her. But I want you to remind yourself that people are getting pregnant and having healthy babies all the time. So you're sitting here focusing on the fact that everybody's having a miscarriage. You had a miscarriage, now your friend had a miscarriage. Lots of people have miscarriages, which is very true and unfortunate, but also lots of people have healthy pregnancies and healthy
Right.
babies. So you have got to take your mind captive and swap from this negative thing is happening all the time to actually this positive thing is happening all the time. And of course,
Yes.
like, as providers, we can't promise anything. We can't promise anybody a pregnancy or that you won't have a miscarriage. But this is another thing I really love about functional medicine is when we address the root cause and don't kind of just like manipulate our bodies into having babies, then you're less likely to have a miscarriage because we've come at it from a foundational health aspect. We've really addressed the root cause. We've kind of nurtured our body and nourished our body to where it feels safe enough to prioritize a pregnancy. So,
Yes.
I think that that's, again, it's something like you can't put a price tag on that. You can't, it's just a beautiful way to come at it, especially when you have negative thoughts like that.
Well, right. Well, when women are having difficulty getting pregnant, there's a reason, right? And it could be even mostly emotional, right? But the reality is until you address the reason why it's not happening, even if you, like you said, if you manipulate with drugs through a fertility clinic and you get pregnant, the underlying cause for the issue is still not gone, right?
Mm-hmm.
The gut issue, perhaps, like the inflammation, the cascade that's happening in your body, the high stress levels at work, the adrenal fatigue, all of these things are still there. You're pregnant, but you're still not in optimal health. And there is a reason why, fertility is indicative of the health of the specimen, right? And
Mm-hmm.
and really two specimens, right? Because it
Mm-hmm.
does take two to create a healthy baby. So I've also had this conversation with a lot of women I do functional medicine with. What's going on with the partner that you're looking to have a baby with? Are they smoking? Are they drinking? Are they doing drugs? Are they under high stress levels? Are they 40 pounds overweight? Like, what is their current health looking like? And if it's not optimal, then they really need to clean up their act too, before you try to get pregnant. Like that's what
Mm-hmm.
preconception is all about. Both partners doing their work physically can and the chemical part, but let's talk about the mental, emotional, spiritual part too. Like what are they holding on, like maybe childhood trauma,
Mm-hmm.
or a bad relationship with the parent, with their own parent. How will that impact them as they're preparing to become a parent? And that is not just for the mom, right? This is
Mm-hmm.
for both individuals, the man and the woman that are looking to create this healthy um, in next generation. So it's up to us to do that work. And if we can do that work before the pregnancy even occurs, we are going to see a different type of family unit. We're going to see a different type of relationship between that couple. We're going to definitely see really beautiful parenting. That child is going to be raised differently. So, I am just such a fan of preconception work and really recognizing that it takes two. And preconception is not just let's detox the body and give it some nutrients and, get the hormones balanced. That is just so bottom line. Like, yes, we're
Mm-hmm.
going to do that. And I want to know, like, what is your subconscious beliefs around parenting?
Mm-hmm.
Are you afraid that you might not be able to get pregnant because other people in your family had, infertility, for
Yes.
example? Are you afraid that you're too old to get pregnant? Are you afraid that you're not going to be a good mother? Like, what are these, really deep type of beliefs
Mm.
that are not true, but are kind of lingering in that
Yes.
subconscious mind? Let's get in there, dig, and release that. So I do a lot of that work with my patients as well, because if we don't release that stuff, it is going to stay with us. It doesn't go away just because we're not either conscious of it or we pretend it's not there. It's still there until we actively do the work to release it.
Absolutely. In my intake paperwork, I have questions like, what is your relationship like with your parents? Where are you in the lineup of your siblings? Do you have any childhood trauma? Because I find that those are the questions I focus on the most. Like, yes, I want to look at your period. Yes, I want to look at your supplements and your medications. But like you said, that is really like just such a small part of it. I have a client
Mhm.
right now who's lost her mother a few years ago and still grieving it. Her mother was like her best friend, and I can't even hardly talk about her without crying because it's just, I can feel we love our mamas, and it's so deep. But I asked her, I said, "Do you think that you have a fear of becoming pregnant?" I said, "I know this sounds funny because you've been trying to get pregnant for a long time, but do you think you have like some kind of sadness or fear around getting pregnant because your mom's not here? Like your mom's not here
Mhm.
to do this with you." And, immediately she started crying and she was like, "Yes, I do." And I was like, "That's what we
Yes.
have to work on." And I said,
Yes.
and that's not always easy. It's not always as simple as taking a pill and fixing things. It's really looking at what are, like you said, your fears, your subconscious fears that you have from your past, something a doctor said to you, your thoughts about
Or from
yourself.
you're 3 years old, that little
Yes.
girl inside of you.
Yes. So it's so important to pull those out. And I tell my clients all the time, I was like, I'm not a trained counselor, but like we are in counseling right now. We are going to talk about all the things. So even when you think, why is she asking me this? This is not fertility related. I'm asking because it absolutely is fertility related. It is health related. So,
It is.
mhm.
It 100% impacts how our health and body functions. And once again, we just talked about how powerful the mind is. And as much as we really want something consciously, our subconscious mind could really, really want something opposite because it's protecting that 3, 4, 5-year-old little girl version of ourselves. And we may not be aware of that, but it will totally interfere with that conscious desire that we're trying to call in. So doing that deeper type of work, I like to use Psych K. That's one modality that can be really helpful. Hypnotherapy is another one. So when we have these types of things and we start to pull them up, it's like we need to identify how to release it. Because also just being aware of it is only the first step, right? What type of things do you do to address subconscious limiting beliefs?
I really talk about again, my program is like really a Christian based program. So I talk about renewing our mind on a daily basis and that you have to take these negative thoughts and really figuring out what is the deepest negative thought you have. And I think for most of my clients, it's that they're never going to get pregnant. maybe I wasn't meant
Mm,
to be a mother. This is kind of
mm,
where their mind has gone because they've been trying for so long and keep seeing negative test after negative test. Like, this isn't meant for me. This is for other people, but it's not for me. So, really taking inventory of what are the negative thoughts you have on a constant basis, the soundtracks in your mind. I think it's John Acuff wrote a book called Soundtracks, and how these are just these negative thoughts are soundtracks in our minds. And if we don't get rid of them, then they influence everything else. And so I'm like, I want you to be very strategic about and very descriptive about the negative emotion you feel about yourself. I'm not meant to be a mother. This will never happen for me, whatever the case may be. And then I want you to very specifically write out an affirmation that the opposite of that. So if the thought is I'm not meant to be a mother, this will never happen for me, then the affirmation has to be I was meant for this. My body is capable of getting pregnant. And then
yes.
anytime you have those negative thoughts, you have this affirmation like stocked and ready. You have it written down. You have it on a sticky note in your mirror so that every time you have it, you don't have to succumb to the negative emotions and the negative thoughts. You already have it handy. Because I think sometimes and more so than just like subconscious thoughts, but anything, if we pre-decide how we're going to react to something, then it changes the way like our emotions overtake us or don't overtake us. So even like we were talking earlier about people having negative things to say. So instead of waiting till, your best friend Ashley comes up and starts telling her negative pregnancy story and you want to shut her off, but you don't know how, you already have a pre-programmed response in your mind. Hey, Ashley, I'm so sorry that's your story. I would love to keep things positive. Tell me your favorite thing about your pregnancy story or something like that. You already have a pre-programmed thought. So the same thing with affirmations, like don't wait till the negative thought comes and then kind of fumble around what to do with it, but you already have something pre-programmed that you say over and over and over. So now this is the new soundtrack. We had an old soundtrack that wasn't true and we practice and it takes time, but we pre-program a new soundtrack that we start to play over and over and over again. And then our body starts
Mhm.
to believe it because we've said it so many times.
Yeah, we actually, and when you're doing that, you want to feel the emotions
Mhm.
around that positivity. So you want to feel good. If you're saying something, but you're still kind of feeling icky, then it's
Mhm.
not going to stick, right? That new soundtrack's going to go in one ear and out the other.
Yes.
So doing that and really feeling good, what lights you up? What's going to make you feel good? Maybe you're exercising while you're saying the
Hmm.
affirmations, doing something that really makes you feel good and and then it will, be like, okay, this is what we need to stick around. Because I do know sometimes people will say affirmations, but they still don't really believe that
Right.
affirmation. They want to believe it, but they
Hmm.
don't believe it. If you don't really believe it, then it's not going to be helpful. It's
Hmm.
not going to be useful, right? So that belief is so important. And the feeling good in our body, doing what maybe you're going for a hike, right? Something that's making you feel good is like that's just all we have to do. Is just we have to do
Yeah.
things that make us feel good,
Yeah.
right?
And we have to do them over and over and over
Yes.
and over again.
What? And if you're doing something regularly that does not feel good,
Hmm.
now's a good time to cut it out. It's like,
Yep.
okay, you know what? I do this all the time and I really don't enjoy doing it.
Mm.
Okay, well, how can we delegate it, automate it, or just say no?
Yeah, absolutely. Yes, I think, and I can tell me and you could go on and on about this topic for forever. And I feel like the overlying theme of this was just how much the functional medicine model can really empower you and bring positivity back into your fertility and pregnancy and birth story. So I have really enjoyed this. Dr. Laura, if you could leave our listeners right now, so they've listened to this and they're like, okay, I do need to change my approach. Functional medicine sounds like a better route for me. What would be the last tip? Because I feel like we've given them a lot of good tips here, but what is like the thought or the tip you would leave them with today? Like the step you would have them take today?
Yeah. So it would essentially be, when was the last time you just sat for 20 minutes and did nothing, right?
Mhm.
When did you just, and maybe somebody is listening and has a regular meditation practice and is like, I do that every day. But if not, because a lot of women are busy and they're taking care of a lot of other people, then they're not giving themselves that 20 minutes daily. And
Mhm.
that is when we can really ground ourselves to our Mother Earth and really get the information and messages that we need to get. If we're just running around like chickens with our head cut off,
Hmm.
then we are not going to be able to make the next best decision for ourselves. And we're just going to be kind of spinning. And that's not where we create health and joy and vitality.
Yeah, absolutely. I love that. Like, get quiet, get with yourself, get away from the distractions, and I'm a
Put
very,
your phone away, put
yes.
it away, put it away.
Yeah, I'm very much so like I'm a paper pen kind of gal. So one thing that worked for me too is like listing and brain dumping. So if you're someone you're looking to work with a functional medicine provider or someone that has a more positive spin, or even as you're listening to me and Dr. Laura, you're like, this is the kind of person I want to work with. I want you to dump on a piece of paper what is important to you, what you're looking for, what's not working with your current provider, what's missing in your current journey, and what you really need. And then again, like Dr. Laura said, and we've talked about, like, it's from the inside out. Your healing's going to come from the inside out. The medicine that you need is you. So trust that you have the power and your body is capable, and then find aligned practitioners and a team that can help you hit your goals. And we are going to drop Dr. Laura's information in the show notes and my information in the show notes. So we would, of course, love to work with anyone that feels fitted to what we talked about today, but find someone that empowers you and makes you feel like this is truly capable and helps you from the root up.
Yes, always remember that our body has innate intelligence. And so when we support that innate intelligence, the healing always occurs.
Absolutely. Thank you so much, Dr. Laura. I really love this conversation, and I'm sure the listeners did too.
Wonderful. Thank you so much for having me.